All right, everyone, we're going to go ahead and get started with the next portion of our agenda. So we will have a presentation by two of my colleagues at CSG, Sarah Needler, who is the Director of Research at the Council of State Governments, and Dakota Thomas, who's a research analyst at the Council of State Governments, regarding American Rescue Plan Act funding. So Sarah Needler at CSG provides research oversight and guidance to CSG policy work and technical assistance to states. Sarah has extensive experience helping governments, nonprofits, and donors achieve better outcomes for the communities they serve by integrating research into actionable, evidence-informed policy and programs. Sarah previously worked within the South Carolina Department of Health and Human Services, where she supported Medicaid policy research. In addition to her state policy work, Sarah has also provided research and technical assistance in advancing evidence-informed policies and programs in Ghana, Albania, and Jordan, and was a U.S. Peace Corps volunteer in the Dominican Republic. Sarah earned her master's in economics from the University of British Columbia and an MPA in international development from the Harvard Kennedy School of Government. Then introduced Dakota Thomas. He's a research analyst at CSG, and he's currently helping lead CSG's efforts to analyze the American Rescue Plan Act and create resources for state leaders that explain the contents of the bill, illustrate the bill's effects on various aspects of policymaking, and to make this information digestible and accessible for members. Dakota also uses quantitative and statistical methods to help make complicated data into clear and understandable reports that reveal new evidence-based insights about states. Using these skills, Dakota has helped lead data analysis efforts, tracking how states have approached scheduling COVID-19 vaccinations. He's also analyzed data on overseas voters to compare their experience casting ballots based on their unique situations. So I want to welcome both Dakota and Sarah with us here today, and I'll turn it over to them.
Thank you, Carl, for that very kind introduction. So as he mentioned, my name is Dakota Thomas, and it is a pleasure to be here today talking to you all about the American Rescue Plan and what that will ultimately mean for states. So Sarah, would you like to introduce yourself?
Hi, great to meet you all today. As Carl and Dakota mentioned, we are here to share some of the analysis that we've been doing on the American Rescue Plan, and really excited to be here with you. I think Dakota's going to kick us off, and then I'll come in for a few more slides, and then we'll have some questions from you all and some discussion. So looking forward to the next 45 minutes or so.
Perfect. Thank you all so much. So I will ask that if you have any sort of clarifying questions, something that can be answered very quickly, just, feel free to go ahead and raise your hand or unmute yourself to ask. But if you have longer questions, if you didn't mind, please save those for the end so that we can fully answer that question and also give other folks on the call a chance to chime in. So thank you so much. Next slide, please. So just to give you a brief overview of what we'll be talking about today, we're really focused on the American Rescue Plan, but first we'll talk briefly about sort of the motivation for that particular bill and some of the other federal legislation that's really had an impact on states. Then we'll move into the actual bill itself, and we've broken it down into a couple of different subtopics just to really make it clear how that bill will align with the sort of purposes of our national task force. Afterwards, that we will briefly talk about some state approaches to using that those funds. And finally, we will have a Q&A and discussion at the end. So just to give some very brief background, as I'm sure everyone knows, the number one thing that has been on the top of mind for almost everyone in the world for over a year now has been the COVID-19 pandemic. Just some background on that in terms of the number of cases. It depends on who you ask, but according to some CDC estimates, about 15% of the entire US population has contracted COVID-19 at some point since February of last year. So that's a huge number of people who have been directly impacted with this. And so it's been very, very important for everyone, really. But to focus on some of the good things, there is a lot of hope and a lot of light at the end of the tunnel right now. So roughly 64% of the US adult population has at least one vaccination. Over 40% of the entire population of the US is fully vaccinated. So that's a really good thing. Unemployment has moved considerably in a good direction. So you can see here that April of 2020 was a very, very high unemployment month, almost 15%, which is higher than it's been at any point in the US except for the Great Depression. May of 2021, things are looking much better. Not perfect, of course, but we're under 6% nationally with unemployment, which is a really good thing. Obviously, the sorts of measures that we've had to take in order to deal with the pandemic, things like social distancing, and of course, what we're doing right now, which is remote work and remote meetings with our colleagues, and all kinds of changes that have been brought on by the pandemic have had a huge impact on how we are thinking about education and civic engagement. How do we connect with people? How do we reach people who don't have internet? All sorts of things that have been made more important by the pandemic. And though, not every state escaped completely unscathed, and some states certainly struggle more than others, a lot of the sort of doomsday predictions of dire budget straits in a lot of states have not been fully realized. And so that's a very good thing. A lot of states are maybe not in a perfect position, but at least in a much better position than we initially thought. And there was a ton of uncertainty about this. And so things are going in a good direction here. Next slide, please. So as you know, the American Rescue Plan Act was signed into law on March 11th. So this is the last in a line of three major federal bills. The first one being the CARES Act, and then CRISA in December of 2020. So this is the most recent one, and it is the largest one in terms of federal efforts at mitigating the impacts of the pandemic, right? So almost $2 trillion in funding that goes for just about everything that you can really think of. So it's some of the biggest bucket items there listed out for you, but state fiscal recovery, almost $200 billion going to states. Education being another huge expenditure in the bill, almost $140 billion in education funding. The others are a little harder to estimate because it depends on a lot of different things, but at least $62 billion in funding for employers, over $34 billion for specific industries, and lots of other stuff. It's a major bill with a ton of different things that it's trying to do. We will not cover all of them, but we will try to cover, the highlights and the things that people definitely need to be aware of today. Next slide, please. And so funds, we can break them down into two sort of very broad categories that might be helpful for state leaders. Some of these funds require action by states in order to actually be spent, right? And so you can see on the left here, things like the State Fiscal Recovery Fund and even the local one, which is more focused on cities and counties, but also capital projects and some agency-specific funds. In order to be spent, states are going to have to decide what to spend that money on, which is going to take up a considerable amount of their time and energy deciding how to actually use that money. On the right, we have funds that really don't require any state involvement. This is things like the direct stimulus payments that have been going out to individual citizens, but also things like funding for tribal governments, changes to the tax code, and other sort of federally managed programs. So no state action needed for those funds to get spent. Next slide, please. Okay, so now we're going to break down the American Rescue Plan into those 4 sort of task force sort of thematic areas. And the big one and the first one that we'll talk about is human health. So much like the task force, we're not just talking about public health or the sort of medical aspects of the bill. We're taking a broader, more holistic view of what health means when we're talking about the ARP through this lens. But certainly public health and medical is a huge part of the bill. And you can see that, right? So vaccine funds are one of the major things being funded here, almost 95 billion in funding for public health efforts related to COVID specifically. This includes about $7.5 billion in funding for community health and about $7.5 billion for the CDC for them to manage their vaccine rollout efforts, as well as $5.2 billion for purchasing vaccines and medical supplies. So it's not just vaccines, obviously it covers personal protective equipment and also things like ventilators, oxygen tanks. And this is really important, as we can see with the situation in India, what happens when the medical system gets overwhelmed and there's not enough medical equipment to really meet the demand. And so this funding is meant to try to prevent that from happening. Next slide, please. So again, taking a holistic view of what constitutes health. We're not just focused on medical and vaccines, we're also thinking about things like childcare. So the American Rescue Plan includes almost $40 billion in funding for childcare, including 2 large grants, childcare stabilization grants and childcare development block grants. That are receiving quite a bit of funding for childcare. And according to estimates, this should help sustain about 450,000 childcare providers, roughly serving about 7.3 million children. And the impact will be even greater than that because every child also has a parent or a guardian who is benefiting from access to childcare. And so the economic impacts of this funding will be very widespread, we anticipate. And we're also hopeful that childcare really will be one of those driving forces that helps to spur the recovery. It's hard to say for sure, but people much smarter than myself have been arguing that one of the things holding back some of the recovery is lack of access to childcare. So ideally, this funding will help to address that possibility. Thank you. Next slide, please. Also, housing. This has been a major impact of the pandemic. A lot of people have been struggling to make their mortgage payments or to make their rental payments to their landlords. And it's very difficult. It's very stressful for citizens who are caught there. It's also not the most ideal conditions for landlords or for construction companies, right? So this has widespread impacts, and we're not fully certain how many people are really being affected by this. So, I've seen estimates for back rent owed by US renters that ranges from about $8.5 billion to an upwards of $52.6 billion. So in either case, that's a lot of money, but there's also just so much uncertainty about what is the size of the problem, how many people are being affected. Estimates on the number of renters who are behind goes from 1.4 to 14.2 million people. So there's a lot of people who are in this category, but we're not really very sure how many or how bad the situation is. But certainly the ARP has funding in it for both homeowners who are behind on their mortgage, through the HAF, the Homeowner Assistance Fund, and also a lot of funding for renters as well, about 21.6 billion, to try to address some of that issue. Next slide, please. Finally, in human health, we have nutrition, right? And so the American Rescue Plan includes about $12 billion total for nutrition funding. Quite a bit of that is going to the Supplemental Nutrition Assistance Program, aka SNAP. Early on in the pandemic, SNAP benefits were increased by 15% to help people have a little bit more additional food security. That benefit increase was funded and extended through September 30th of this year. So that's one area, but also the food supply chain, right? So $4 billion for supply chain efforts. And as we all know from the great toilet paper shortage of 2020, supply chains in the United States, depending on the product, can be a little bit more brittle than we might prefer. This affected, of course, toilet paper, but also things like hand sanitizer, beef, chicken, even baking yeast from that period where everyone was doing sourdough. So very important stuff, and it's being addressed hopefully by this funding. So next slide, please. This just provides a very broad overview and breakdown of all of the various funding priorities. Obviously, we cannot begin to cover everything that's in the ARP. It's a monster of a bill, but if you're very interested in the nutrition stuff, this will give you a general idea. You can see that there's money in there for USAID, which is foreign aid, also for women, infants, and children, and a bunch of other programs. Okay, so next slide, please. Okay, and so as I mentioned, taking that holistic approach, we're not just thinking about physical health, we're also thinking about economic health and the workforce, and how does the ARP impact that? And so one of the major things is unemployment. So the coronavirus relief efforts, including the CARES Act and CRISA, have created a number of new federal unemployment programs, including the Pandemic Unemployment Assistance Program. So this was for people who didn't qualify for their state's unemployment, could apply and qualify for federal unemployment assistance through this program. That was extended through September 6th, and people's eligibility was increased from 50 to 79 weeks. There was also the Pandemic Emergency Unemployment Compensation, or PEUC. This is for people who have exhausted their state benefits. They did qualify for them, but they've run out of weeks. So the federal government would pick up the tab for those people for a brief time. Eligibility was extended to 53 weeks on this, and it was also extended through September. And then, of course, finally, the most controversial one being the Federal Pandemic Unemployment Compensation, or FPUC program. This is a benefit top-off. So this is the extra $300 per week that people who are unemployed could get from the federal government. And this program was extended through September 6th, but half of states, as of yesterday, it's 25 states, just as a sort of a preview, for those of you who have been following our efforts with the ARP, we are looking at how that will affect states. And so if you're really interested in that, I would encourage you to check out our website and monitor in the coming weeks. We will have a resource specific about unemployment and what that will mean. Next slide, please. Okay, so one other thing that was really important in the ARP were focused on employers and industries, right? And so two of the big things to note there, and this is hardly everything, but two of the most important things in here are the Paycheck Protection Program. This program was not extended, right? So there are no new applications being taken for this. March 31st was the last day that employers could use this program, other than like retroactive applications, so no new stuff. But it was expanded to cover more businesses and especially more nonprofits that previously couldn't use this program. And that funding is meant to cover that expansion, right? So $7.25 billion to make sure that everyone can get that who qualified. The big one for employers, another big one for employers is the employee retention tax credit. So this is money back to an employer, basically to try to incentivize them to keep employees on their payroll rather than to lay them off. The ARP made a number of changes here, so expanded it to severely distressed businesses. It's now for a greater share of employee wages, but it was also changed from all employment taxes to only for Medicare. So some pretty big changes there, and we'll be monitoring how that actually affects things. Next slide, please. So this is not everything in the ARP that affects employers, but it's a breakdown of at least some of the larger ones. So like we mentioned, the Paycheck Protection Program is a big one. But also we have these targeted loans that got $15 billion for that. Shuttered venues, the entertainment industry and the music industry were hit pretty hard by lockdowns and social distancing. So that was $1.25 billion. Restaurants that had been hit by the pandemic, $28.6 billion. And then of particular note, the State Small Business Capital Initiative got $10 billion. So this is based on a program that happened after the 2008 recession that had lapsed in, I want to say 2017 is when that shuttered the first time. So this is $10 billion to do a new version of that program, which will allow states to loan money to small businesses. So very interesting, at least $62 billion going to these employer specific programs. So next slide, please. Finally, this is not all of the targeted industry funding, but as we mentioned, restaurants were hit very, very hard. And so the Restaurant Revitalization Fund was a big bucket of funding, $28.6 billion in funding there to help restaurants impacted by the pandemic. Also air travel, which had been hit very, very hard, got $3 billion for paycheck or payroll protection. And this was expanded from just airline workers to people who work in airports, including concessions and food service, as well as manufacturing, right? So people who build planes are now eligible for payroll protection because there just wasn't much demand for new planes there for a while. Next slide, please. So with that, I will hand it off to my colleague, Sarah Needler, who will tell us about Civic Health. Thank you.
Great, thank you so much, Dakota. And as Dakota mentioned, I'm going to now talk about some of the funding in the ARP that could be designated for civic health. As opposed to human health and workforce development and employment, the funding that's going for elections is a little less straightforward, but we're still going to include some funding in here that states could utilize for the purposes of civic engagement and inclusion. So overall, there is approximately $1.8 billion in funding that can be used to enhance election practices and promote civic education and inclusion. And you'll see those buckets of funding here on this slide. The first one is $650 million, which is available to the Cybersecurity and Infrastructure Security Agency. And this funding is important because this is the agency that really works with states to secure their election infrastructure. And for the 2020 presidential election, the Cybersecurity and Infrastructure Security Agency was also heavily involved with combating foreign disinformation and misinformation. So this is really an opportunity for states to work with the Cybersecurity and Infrastructure Security Agency for opportunities for elections and other critical election infrastructure. And one thing that states might consider is working with the agency on combating misinformation and utilizing these funds towards that goal. The second bucket of funding is the $135 million, which is available for the National Endowment for the Humanities. And these are grants that are going to state humanities councils to prevent, prepare for, and respond to and recover from the coronavirus. And the Federation of State Humanities Council lists a number of objectives and goals as part of their work, but one of those is strengthening democracy. So this is yet another opportunity that states could work with the National Endowment for the Humanities, possibly receive some grants to work towards civic engagement and education. Another bucket of funding is the $200 million that is available for the Institute of Museum and Library Services. And this is a grant-making organization that they work with museums and libraries to help them, specifically for the purposes of this bill, to recover from decreased patronage due to coronavirus. So again, this is an opportunity where states could partner with museums and libraries to utilize those funds to expand civic engagement and education opportunities. And it's possible that this could be also done in collaboration with educational institutions who are also receiving education funding as part of the ARP. And then finally, we have $852 million, which is available to support the Cooperation for National and Community Service and the National Service Trust. And this is the parent agency of AmeriCorps, and their stated mission is to improve lives, strengthen communities, and foster civic engagement through service and volunteering. So again, this is an opportunity where states could partner with CNCS to fulfill critical needs within the state and incentivize community service and community engagement. And one example of what a state could do with some of this funding and partnerships with these organizations is something like North Carolina has done, where the North Carolina State Board of Elections has actually launched a combating misinformation landing page on their website. And this page defines election misinformation and disinformation and outlines steps that the board is taking to combat it. So one example of this is a social media campaign that North Carolina had called Mythbuster Monday, where they referred to common myths about voting and election in the states and addressed those concerns. So that's just an example of what states might want to consider when partnering with these organizations. Next slide, please. So now wanted to look at the fourth subcategory, which is fiscal health, which obviously all these things are kind of going towards a state's fiscal health, but for this part of the presentation, we really wanted to focus on the Coronavirus State and Local Fiscal Recovery Fund, which I'm sure you're all pretty familiar with and have already started grappling with how to utilize these funds, but going to give a quick overview and then maybe some examples of utilization. So the Coronavirus State and Local Fiscal Recovery Fund are the funds that are going directly to state and local governments. As you can see here, there's $350 billion as part of this recovery fund. 219.8 billion of those are going to the state fiscal recovery fund, which includes funding going directly to states in Washington, D.C., tribal governments, as well as U.S. territories. And then the local fiscal recovery fund are the funds that are going to counties, metropolitan cities, and non-entitlement local governments. And in addition to this $350 billion of direct funding, as part of this fund, we also have the Coronavirus Capital Projects Fund, which is also funding available, direct funding for states to invest in capital projects. And this funding is going to be sent out in a couple of different ways, depending on the state. So states will either receive these funds in 1 or 2 payments. And this is going to depend on the percentage point net increase in the unemployment rate from February 2020 to the latest available data when states are applying to receive these funds. And if the state had at least a 2 percentage point net increase in the unemployment rate, then they will be receiving the funds in a single payment, which are available now if you have not already applied for those. And then states who did not have that much of an increase in unemployment rates since February 2020 will actually receive those payments in 2, so one now and then another one in May 2021. And those funds are available for receipt now. So there's a portal on the Treasury webpage where states can go to sign up for that. And if you all have not done that already or need assistance with that, we're happy to do so. And I'll give a little bit more information about some of the other resources we have available towards the end of the presentation. But next slide, please. So this is just breaking down a little bit further how those funds are allocated to states. And there are a lot of tables of estimates that should be going to each state, both on our website as well as other resources. FFIS has some estimates that they've been updating as more information and guidance has been coming from the Treasury. But for the State Fiscal Recovery Fund, 195.3 billion will be going to each state. This is kind of the base payment. And each state is assured a minimum of $500 million. And then the 169 billion is allocated based on the state share of unemployed workers. And the Coronavirus Capital Project is the same in that there's a base minimum amount that each state will receive, which is $100 million. And then the remaining funds will be allocated based on population, share of rural population, and then the share of population in poverty. Again, I know this seems like a complicated formula, but there have been other people who have already done that work for us. So we do have those tables of state allocations that we can give to you and we'll link to here in the chat at the end of the presentation. Next slide, please. And so this is really the question that I think all of us have been thinking about a lot lately, and especially now that we have a little bit additional guidance from the Treasury, is how can these funds be used? So the Treasury has outlined in their interim final rule several different ways that this fund can be used. And this is kind of the 6 or 7 broad categories that we have to work under. And that includes supporting the public health response, addressing negative economic impacts caused by the public health emergency, serving the hardest hit communities and families, replacing lost public sector revenue to avoid cuts to government services, investing in water and sewer infrastructure, as well as broadband infrastructure. So even though these categories are very broad, which I think is a great opportunity for states to use this funding and really have discretion over how these funds are being used, I think the struggle now is just making sure we understand what will be covered and what won't be covered in advance of actually spending and planning to spend that funding. So the Treasury has given some additional guidance as to what might be an example of the way states could use funds under each of these categories. So for example, for the addressing the public health response, there's some things that could be included in that is purchasing PPE or support for those that are in quarantine or in isolation. Also under that includes improvement of ventilation systems in key settings. So that might be in healthcare facilities, improving ventilation. And then also included specifically is increased demand for mental health and substance misuse services would fall underneath those categories. Some things that would fall underneath the negative economic impact category would be things like direct assistance to unemployed workers. Also, states have the option of replenishing the unemployment insurance fund to pre-pandemic levels. Could also include premium pay that's going for essential workers, also job training, loans and grants to small businesses. So a lot of different ways that these funds could be used to offset those negative economic impacts. And then the other one that kind of leaves us with a broad interpretation is serving the hardest hit communities and families. And some examples of how that funding could be used would be funding community health workers. Could also be support for schools in low income areas. Another example is remediation of lead hazards, and then also interventions to address community violence. So those, again, are some opportunities. But as I mentioned, the Treasury does have guidance on this in the interim final rule, as well as a frequently asked questions document that they are revising on a somewhat regular basis. I think the last time there were some revisions was on June 8th. So essentially, as the Treasury is receiving additional questions from state leaders, they're updating that frequently asked question guidebook to include new questions, and they're very specific questions about how funds can be used. So it's a really great resource, which I'll link in the chat here in just a moment. And I just encourage you, as you are starting to think about utilization, to please feel free to contact us. We're happy to help take a look at the bill and help analyze whether or not an expense might be covered by the allowed uses of the recovery funds, but also encourage you to also send your questions directly to Treasury and your any kind of questions or responses to the final rule as well. So there we can provide you with that contact information as well. Next slide, please. So in addition to those examples of how funds could be used, we also wanted to highlight a few other opportunities for utilizing those funds. And I'm actually getting ahead of myself. Let me first just cover the slide here on restrictions to recovery fund utilization. So there are not a whole lot of restrictions, but there are some big restrictions to keep in mind on how these funds can be utilized. The first of those is that it cannot be used to directly or indirectly finance a net decrease in tax revenue. Also cannot be deposited into any pension fund. And there's also the limit of capping premium pay for essential workers at $25,000. And here's actually the link to our analysis of the Treasury guidance that came out a few weeks ago. So feel free to go to that website, and we'll also link the full website in the chat at the end of the presentation. So next slide, please. Now we get to talk about the fun opportunities for utilization, which I was jumping to. So as I mentioned, we've been deep diving into this bill and really trying to understand what funds are available and how those funds can be used. And there are really a lot of ways with such discretion, especially over the state and local fiscal recovery fund, that states can use this funding that aren't necessarily explicitly outlined and detailed in the ARP. And so we just wanted to highlight some of those examples, and we've actually done briefs on all of these topics, or will be having them coming out in the next couple of weeks at least, on the different opportunities for utilizing these funds that might not be spelled out in the bill itself. So I just wanted to go over a few of those. I have a few on the slides, but I'll dig a little deeper into a handful of them. And we've just broken this down again by the thematic, the themes of the subcommittees for the Healthy States Task Force, just to make it a little simpler here. But for health, there's several opportunities, but one big area that is mentioned in the ARP, but also states could use the discretionary funding, is for mental health. So there is a lot of SAMHSA block funding grant that is included in the ARP, but states could also utilize this state and local recovery funding for mental health support as well. And some opportunities that we've analyzed and have included in our briefs are that states could use that funding to fund mobile crisis outreach teams. So having teams available to meet individuals where they are at in terms of mental health crises. Also, mental health services in school. This is again a way to supplement the funding that's going to schools and school systems from education funding, but also could utilize some of this fiscal recovery funding for mental health purposes in schools. And it could also be helping to address the workforce needs of those in the healthcare sector. So that might be loan forgiveness programs, maybe support for licensure, making sure individuals have a clean-cut way to get licensed to provide mental health and behavioral health services in your state. Another opportunity specific to human health could be vaccine distribution. And this is one that we've already seen a lot happening in the last few weeks, especially around incentivizing vaccine participation. So that's another way that these funds could be used. An example of economic and workforce health, there's a few on here, but I think one in particular, which I think is one pathway forward that's not included explicitly in the bill, is in terms of apprenticeships. So really investing in apprenticeships have a lot of benefits, including expanding and getting people back to work, upgrading skills, shifting them to new career paths, and really focusing on that, the challenge that a lot of states are confronting of having enough individuals in the workforce, taking up those jobs where now we're needing to hire new people. And so apprenticeships is really one way to address that. So investing in apprenticeships expansion programs could be one way that states could utilize ARP funding. That could be grant programs for community college, for technical schools, for universities. And I know Iowa, New Jersey, Rhode Island are just a handful of states that have these type of expansion grant programs for apprenticeships. Could also be things like public sector apprenticeships, which Kentucky is a state that's really leading in that, making sure students and folks who are wanting to work in the public sector have the opportunity to have apprenticeships in that area. Another would be to reduce any of the startup costs for employers who want to take on and start apprenticeships. And then also offering tax credits to employers who are hiring apprenticeships. So those are just a few ways that the funding could be used towards workforce health and economic development. And there's so many more, but I'll keep the examples at that one. And then for civic health, I guess I kind of went over those examples a little bit already, but North Carolina being one of the big examples of kind of how to invest funds in combating misinformation. And then fiscal health, a few examples of ways, opportunities for utilizing that might be through basic income programs or stipend programs, as well as evidence-based policy programs. So the basic income programs is essentially direct payments to residents of the state that will be conditional or unconditional. And one example of this is Alaska and their permanent fund dividend. But California also has proposed in their budget for a pilot program for a basic income program where they would be partnering with local governments to provide payments to residents. So this is in one way that states might be able to use funding to do additional direct payments to citizens. And there's been a lot of research on basic income programs, both in the US, but also internationally, about the effectiveness of that money going direct to residents, which again, I won't go into too much detail, but we do have that all written up in a brief on our website. And then another opportunity, which I'm very excited about, is the evidence-based policy. So I think one other complication of this funding is that it's a one-time use funding for the next few years. And then we have to think about how those funds can be sustained beyond this initial bump of funding. So investing in evidence-based policymaking and piloting innovative new solutions is really one way that these discretionary funds could be used. So if you're thinking about a challenge that has kind of persisted for your state and you're wanting to come up with a creative solution to addressing that, but you've never been able to try it before, there's been no other states who have tried that before, this funding really gives an opportunity to try something new, to pilot a new policy or a new program in your state, while also using some of the ARP funding for implementation, but also for evaluation of that program to see, is this program actually going to address the challenge that I'm trying to solve? So it's really a great way to explore new options and to find what works in your state. and to be able to identify the things that do work so that we know it's worth investing future funds into those programs and policies versus things that maybe aren't so successful. So those are things that we won't want to do again or won't want to keep doing. So I think that's just a really fun way that these funds can be used as well. And then next slide, please. Just wanted to give a few examples of some states who have started thinking about ARP fund utilization, which I know that's probably everyone at this point, but wanted to just give a handful of examples and also just let you all know that we are going to systematically be tracking utilization of these funds by all states, and we'll have that information on our website just as a way to know what are other states doing, what have they been able to do that we don't think we're able to do, just really learning from each other. And so we'll have all that information available in the next few weeks, which we're happy to share with you. Vanessa and Carl can send you links to that page once it's up. But in the meantime, wanted to share a few examples and try to kind of capture an example from each of the 4 committee themes as well here. So in Kansas, Governor Laura Kelly has recently announced the 614 non-entitlement units of government that are to receive the ARP Local Fiscal Recovery Fund. And this is really just highlighting that for those state and local fiscal recovery funds, although it's very exciting to start thinking about how that funding is going to be used, there's also a lot of intermediary steps that are having to happen, which is this example from Kansas was one of those, of even figuring out who are those non-entitlement units of government who are going to utilize these funds. How is that going to be distributed? So that's one thing that happened this past week in Kansas, is really confirming that final list of who those non-entitlement units of government are and how much funding they're going to be using. In Kentucky, their Governor Andy Beshear signed a bill to improve voter participation and election security measures. So although there's not a direct amount of funding tied to that, that was a recent bill signed to promote election security measures, which really falls underneath civic engagement. So I expect we'll see similar types of bills from other states that are supporting civic health. And then in Nevada, there was recently $20.9 million that was allocated for the public health emergency. And that specifically included mental health, substance use disorder treatment, and other behavioral health services. And right now that bill is, quite broad in terms of how that's going to be spent. But over the next several weeks, I expect we'll see how those funds for mental health will be invested, what specific programs, what specific policies are going to put in place to address substance use disorder treatment. So looking forward to those updates. But this is just to show that mental health is definitely one of the priority areas where states are starting to think about utilizing those funds. And then a final example is in Vermont. Governor Philip Scott has included in his proposal $50 million for economic recovery grants that would go to businesses. So this is one form of direct payment to small businesses that would fall underneath the economic development purposes of the state and local fiscal recovery funds. So like I said, this is just a handful of examples. There's a lot out there, and I know that you all are more of the experts at the utilization part than we are. We've been analyzing the bill, but now it's you all who are making the hard decisions about how these funds are actually going to be utilized. So as part of our question and answer session, also very much looking forward to hearing from you all about how you plan to utilize these funds, what you want to know from other states. Even if we're not able to answer all the questions right now, I expect we'll be able to answer more and more as we hear more and as the Treasury updates their frequently asked questions. But we'll also happy to help assist in get any answers that we can for you over the next few months. It's going to say weeks, but I imagine it'll be more like months. So next slide, please. Great, and this is just information from Dakota and I. Please feel free to reach out to us at any time. Give us a call, send us an email. Also feel free to go through Carl and Vanessa. But this is also our fiscal recovery webpage where we are putting all of our analyses and briefs on the ARP and other federal funding going to the states, including write-ups of things on like the proposal for the American Families Plan and any other proposals and things like that that are coming out. So we'll put that in the chat if it's not in there already, but it's our recovery webpage. And encourage you to take a look there and see what resources we have out there. And that is it for now, but want to spend some time answering your questions as well as just having an open discussion about utilization of funds. Thank you.